Did you know that the vitamins sitting in your medicine cabinet right now could be increasing your stroke risk by up to 40%? If you're over 60, this could be a matter of life and death. I'm about to reveal 5 common vitamins that millions of seniors take daily, thinking they're protecting their health when they might actually be putting themselves in danger. Before we dive into these shocking revelations, make sure to subscribe and hit that notification bell because this information could save your life or the life of someone you love. Let's get started. Vitamin number 1 that could be raising your stroke risk is vitamin E. Now, I know what you're thinking. Vitamin E is supposed to be good for you, right? It's an antioxidant that fights free radicals. But here's where it gets dangerous for seniors. Large-scale studies have shown that high-dose vitamin E supplements, particularly those containing more than 400 international units daily, can increase the risk of hemorrhagic stroke by up to 22% in older adults. This happens because vitamin E acts as a blood thinner, and when you're already taking medications like aspirin or warfarin, or if you have underlying cardiovascular conditions, this combination can be deadly. The problem is that most seniors don't realize they're getting vitamin E from multiple sources. It's in their multivitamin, their skin cream, their eye health supplement, and even fortified foods. This accumulation effect means you could be getting 800 to 1,000 international units daily without even knowing it. Here's what you need to do right now. Check every supplement bottle in your house. Add up the vitamin E content. If it's over 400 international units, you need to talk to your doctor immediately about reducing your intake. Vitamin number 2 is even more shocking because it's something doctors often recommend. Vitamin K supplements, especially vitamin K2, have become incredibly popular among seniors for bone health. But here's the terrifying truth that most people don't know. Vitamin K directly affects your blood clotting mechanism. If you're taking blood thinners like warfarin, which millions of seniors do, vitamin K can completely counteract these medications. This creates a dangerous rebound effect where your blood becomes hypercoagulable, meaning it clots too easily. Studies from the American Heart Association have documented cases where seniors on blood thinners experience stroke within weeks of starting vitamin K supplements. The most dangerous part? Many of these supplements don't clearly warn about this interaction on their labels. But even if you're not on blood thinners, excessive vitamin K intake can still be problematic. Some seniors take mega doses thinking more is better, but this can lead to calcium deposits in your arteries, actually increasing stroke risk rather than decreasing it. If you're finding this information eye-opening, please take a moment to subscribe and like the video. Sharing this could help someone else avoid serious health risks, and I've got even more important tips coming up that you won't want to miss. The third vitamin that could be putting you at risk is one that might surprise you completely. Vitamin B6, also known as pyridoxine, is often recommended for seniors to support brain health and reduce inflammation. But research has uncovered a dark side to this seemingly innocent vitamin. High doses of vitamin B6, particularly above 100 milligrams daily, can cause peripheral neuropathy, but more importantly for stroke risk, it can interfere with your body's ability to process homocysteine effectively. When homocysteine levels become elevated, it creates inflammation in your blood vessels, making them more prone to clotting and increasing stroke risk. Many seniors unknowingly take multiple B6-containing supplements. It's in B-complex vitamins, energy drinks, fortified cereals, and individual B6 supplements. The cumulative effect can push your intake well above safe levels. Here's a critical warning sign to watch for. If you're experiencing tingling in your hands or feet, balance problems, or unusual fatigue, these could be signs of B6 toxicity, and you need to stop taking these supplements immediately and consult your doctor. Moving on to vitamin number 4, and this one is going to shock you because It's probably the most commonly taken supplement among seniors: vitamin D. Yes, the sunshine vitamin that everyone says is safe and necessary. While vitamin D deficiency is indeed a problem, vitamin D toxicity is becoming increasingly common among seniors, and it's directly linked to increased stroke risk. When you take too much vitamin D, your body absorbs excessive amounts of calcium from your food. This extra calcium doesn't just strengthen your bones, it can deposit in your arteries, creating atherosclerotic plaques that increase stroke risk. Recent studies have shown that seniors taking more than 4,000 international units of vitamin D daily have a 17% higher risk of atrial fibrillation, a heart rhythm disorder that significantly increases stroke risk. The problem is that many seniors are taking 5,000, 10,000, or even 20,000 international units daily, thinking more is better. What's particularly dangerous is that vitamin D toxicity develops slowly. You might not notice symptoms for months while your arteries are slowly hardening. By the time you develop symptoms like kidney stones, bone pain, or irregular heartbeat, significant damage may have already occurred. The fifth and final vitamin that could be raising your stroke risk is vitamin A, particularly in its retinol form. This is especially concerning because vitamin A is fat-soluble, meaning it accumulates in your body over time. High levels of vitamin A can increase your risk of stroke through multiple mechanisms. First, it can cause liver toxicity, which affects your body's ability to produce clotting factors properly. Second, excessive vitamin A can lead to increased intracranial pressure, putting stress on your blood vessels in the brain. Many seniors get vitamin A from multiple sources without realizing it. It's in multivitamins, vision supplements, skin products, and fortified foods. The recommended daily allowance for seniors is only 700 to 900 micrograms, but many supplements contain 3,000 to 5,000 micrograms or more. Studies have shown that seniors with vitamin A levels in the highest quartile have a 29% higher risk of stroke compared to those with normal levels. The most dangerous part is that vitamin A toxicity can occur even with amounts that seem reasonable when you consider all sources combined. So what should you do with this information? First, don't panic and throw away all your supplements tonight. Instead, take these 3 critical steps. Step 1. Make a complete list of every supplement, medication, and fortified food you consume. Calculate the total amount of each vitamin you're getting daily. Step 2. Schedule an appointment with your doctor or pharmacist to review these amounts and discuss potential interactions. Step 3. Consider getting blood tests to check your actual vitamin levels rather than guessing. But here's what matters most. No supplement can replace the foundation of real health, and that's your diet. A balanced, nutrient-rich diet isn't just a good idea, it's the starting point for a healthy, energetic life. If you're relying on pills to fix what food should be doing, you may be setting yourself up for long-term problems. That's why I've included a personalized nutrition plan as the first link in the video description. It's tailored to help you build a healthier lifestyle from the inside out, safely, naturally, and with real, lasting results. If this video helped you, hit that like button, subscribe, and share it with someone who needs to hear this. And when you're ready, keep watching. There's more important content waiting that could make all the difference in your health journey. Take care of yourself, and I'll see you in the next one.